Now, the Health Minister, Maria Caulfield, claimed on this programme last Wednesday that there are significantly more dentists seeing NHS patients. The British Dental Association says that just is not true, and people are travelling, in some cases, hundreds of miles for essential emergency care. Here's a reminder of what she said on Wednesday.
If you were asked the question I'm getting all the time, I can't get an NHS dentist, what should I do? I don't have an answer. Do you have one at the moment, or is the answer just suck it and see?
No, absolutely. As a constituency MP, I get this question all the time myself. And what I will say to you is we have a website. You can type in your postcode. It will show you your nearest NHS dentist and which groups of patients they are taking on. I can tell you from my own casework experience that this time last year, it was very difficult to find a dentist taking on new NHS patients in Sussex. If you go on now, there are significantly more.
Right. Significantly more in the Health Minister's constituency. But many of you got in touch to say you were outraged by what the Minister said, and some reported their nearest available NHS dentist is 60 miles away. In Maria Caulfield's own constituency of Lewes, only 1 in 7 NHS dentists are taking on new patients, and there is still a backlog at that one practice, with the next available appointment said to be in the second week of April.
Well, we're joined now by the chairman of the British Dental Association, Eddie Crouch, along with Matt Bamford, who says he's been waiting for an NHS dentist for 10 years, and Layla Waters, who's pulled out her own teeth after calling, get this, 50 dentists with absolutely no luck at all. We'll talk to you two in just a second. But first of all, Eddie, like me, you were watching that interview, you with a lot more inside information than I had. My jaw hit the carpet when I heard her say that, because I thought, well, that just is not the experience that we keep hearing on this programme. You, in your position, were flabbergasted by that claim.
Yeah, absolutely. I mean, there is a website that people can type in their postcode, but what they will find is, sadly, you know, like you found with Maria Caulfield's constituency, only a very small percentage of my colleagues are able to take on new patients at the moment. Last week, I attended the Health Select Committee where Andrea Leadsom, who is the Minister for Dentistry, was there, and she was talking about the recovery plan. Well, in reality, she had to backtrack on some of the things that she had been saying about that recovery plan, because in our opinion, it's not a recovery plan.
So what do you think she was playing at in what she said in a live interview here?
Well, I think we've got a general election this year. Dentistry is on the doorstep with people. We've heard from by-elections that dentistry is featured quite significantly. And as a consequence of that, I think, you know, they're trying to paint a picture, sadly, that isn't there at the moment. You
said you almost threw something at the screen when you watched it.
Yeah, it's frustrating, especially when you know what the situation is, because, you know, there are thousands, well, millions of people, 12 million people, we believe, who are struggling to gain access at the moment. And I feel so sorry for those people that really were not coming up with proper solutions.
Well, let's speak to two of those people. Matthew Bamford. Matthew, you watched that interview, didn't you, with the Health Minister here on Good Morning Britain? And how did that clash with your experience?
Well, I mean, I totally disagree with everything that she said, to be honest. I've been looking since 2014 for a dentist after leaving the military. There's nothing available at all. And on the new app that you use, the app's been running for quite a while, but it just gives you a list of dentists. But when you use the app now, it does show that there's availability. When you phone the practices up, there's nothing available at all.
So when you put your details into that website, as Maria Caulfield suggested is the way to do it, what came up? A number of different NHS dentists, but when you called, what information were you given about whether you could join up?
I mean, out of the list of dentists that actually appeared on the actual app, there were several that showed that they were accepting adult patients. Every single one that you contacted, they said, we've actually got a full waiting list now. And it's at least 12 months before you're even going to get accepted for any form of care.
So what was the situation? Did you say, well, put me on the waiting list then and I'll just simply wait? Or did you just think, I'll try somewhere else?
They don't offer you the option to go on the waiting list. When it goes over 12 months, they just say, really sorry.
What problems do you have currently with your teeth then? What needs doing?
I mean, I was quite ill for 12 months, so bedbound. So my oral hygiene, when I had chronic fatigue, I've lost fillings. I had a massive abscess in my lower jaw. I've had the root canal stage 1 done that I managed to get done through the dental school, but that was kicking and screaming. But stage 2 and 3 need to be done by NHS dentist or pay private.
Are you in pain?
Not all the time, but it comes and goes.
Yeah.
But I've got so many missing fillings that it's just a case of waiting for it to happen now.
All right, can we just come across to Layla now?
Just before we go to Layla, I just wanted to ask Eddie Crouch. So, you're a dentist, Eddie. You are chair of the British Dental Association. Matthew there has chronic problems with his teeth, and I expect, as you're listening, you're imagining the things that could go wrong, right? He's missing lots of fillings. He faces pain and perhaps infection. I don't know. Is it? I mean, I don't want you to diagnose Matthew on air, but I suppose you can't help but think you need to see a dentist quick.
Well, he explained that he'd started some root canal treatment, and normally the best prognosis for that would be to actually get it completed within a short space of time. The consequences of not having that done will mean that the infection will come back. He'll need perhaps another course of antibiotics. We've got problems with antibiotic resistance. You know, we're really frustrated. I'd love to be able to point him in the right direction. But the problem at the moment is we've got people turning away from the service, not coming into the service like Maria Caulfield suggested.
And Matthew says he has contacted all of those people who were on the website, all those dentists.
Yeah.
The dentists say, we have a waiting list. It is for 12 months. You can't go on it. Is that the case? Is that do waiting lists close so that Matthew simply can't even get on a waiting list to be considered to join up?
Well, there are some dentists that have a waiting list, but it's incredibly frustrating to put people on it because people are ringing up all the time to the practice saying, you know, where am I on that waiting list? And if that waiting list is really quite long, it's frustrating for the patient. They get angry. It's frustrating for the practice.
What would you suggest Matthew does? I mean, poor chap, there he is sitting there. He hasn't been able to get to a proper dentist for 10 years.
Yeah.
What does he do?
Well, I think he needs to complain to his MP. I've met 230 MPs in the last couple of years, and they all tell me that this is a workforce problem, that we haven't got enough dentists. But clearly we have got enough dentists. We just haven't got enough dentists that want to work on the NHS.
Matthew, what do you make of that? I mean, you know, you can't see a dentist, so the British Dental Association say, write to your MP.
I've actually already wrote to my MP. I wrote back in 2022 to Louise Haig.
Well, you know, it's almost as if one can hear heads banging against walls all over the country.
What did your MP say?
I mean, the response I got looked more or less like a generic response about who's responsible for the problems rather than trying to fix it.
I see. Well, we have been, as I said earlier, inundated with accounts from viewers watching this morning who have been forced to pull their own teeth out with pliers in the kitchen. I mean, that's what's going on out there. And we have one of them on camera now, Layla Waters. How many teeth have you pulled out yourself, Layla?
It's 5 so far.
Right. Now, when you have an extraction at the dentist's, you get injections, or you might get sedation. You might even be given a full anaesthetic, but you get proper pain relief before the tooth is pulled out. You obviously couldn't do that.
No, I couldn't. The pain gets to a stage where you just can't take anymore. And when you're continually trying to get either into an emergency dentist, because we're so low on NHS dentists, the emergency dentists are rammed. So I was able to phone when I get infections and they'd send me prescriptions. But when it comes to actually getting an appointment to go through,
no,
I can't get one. I've not seen a proper dentist in over 7 years now.
But what I'm getting at is the pain of the extraction itself must be unbelievable.
Yeah. And you can't describe the pain. It's the first time I did it, I almost passed out. Okay. It was unbelievable. But all I could think about was the relief at the end of it, because I just couldn't carry on the way that I was.
And how did you do it? Do you stand in front of a mirror and did you use pliers? I mean, can you describe what you did?
I got a bit of kitchen roll and I covered the tooth and I just pulled.
With pliers?
Just closed my eyes and pulled until it was out. And
what about bleeding?
Because my teeth are so loose now, because I've not been able to see a regular dentist, there's not been an awful lot of bleeding. Like I say, because they are all so loose, I've only got 4 teeth that aren't loose now. And that's because I can't get into a dentist. I do everything, I clean my teeth, my oral health is good, but there's no dentist out there.
And when you go onto the website, Layla, which says, this is where your local dentist is, because this is the advice from the health minister, what happens?
I phoned, I think all in all, I think we're on about 55, 60 dentists that I've phoned. One of them offered to put me on their waiting list because it wasn't, she said it's about a year wait. So they put my name down and I left it a good 9 months and I phoned them back and my name wasn't even on the list. And because the list had grown, they couldn't add me to it.
Well, let's put your case then to our dentist in the studio, Eddie Crouch from the British Dental Association. What are the consequences of pulling out your own teeth?
Well, sadly, you could end up with a fracture of the tooth. You end up going into hospital and need surgical extractions in hospital, costing the NHS an awful lot of money. But, you know, it's not something we should have to do in a civilised country. People sitting in their own kitchens taking their teeth out.
If I could sort of wave a magic wand and make you Secretary of State for Health with unlimited powers and a good wad of cash, how would you fix it?
Well, I'd start talking to the person who'd be in my chair. You know, we, as the profession, have got plenty of answers. What we need is honesty about this. The Minister has said that, she's created 2.5 million extra appointments. She had to admit in Parliament last week that that was unreliable evidence.
So what are your answers?
My answers are to sit down with the profession and let's be honest and open. If we can't afford a comprehensive dental service for the whole of the population, let's sit down and talk about what we can provide for people, exactly like we've heard from this morning, so that we have a urgent and emergency service for everyone.
Insurance?
No, sadly, where we've seen insurance in other parts of the world, the insurance people control what is available and the insurance premiums will go up. So insurance is not the answer. We need either a fully comprehensive, well-funded dental service or we need a core service that is available for everyone.
Yeah. I just want to go back to Matthew Bamford. Matthew, you've been waiting 10 years since you last saw a dentist officially. You were last on a dentist list. And just as you've been listening to all of this and telling your story, I know it sort of has an emotional impact, doesn't it?
Yeah, I mean, it saddens me, not just for myself, because I know of many other people that are in the same boat as me. And it is, I mean, the money's there, it just needs investing wisely. And I don't think the government do, to be honest with you.
No, I mean, look, when we spoke to the Health Minister, Eddie Crouch, she said, we're seeing about 2.5 million more appointments being made. We're seeing significantly more dentists coming forward and taking on NHS work. I mean, even if that's not getting everybody an appointment, that sounds like millions more people are seeing a dentist, an NHS dentist.
Well, I mean, often they talk about the numbers of people who are now seeing an NHS dentist in comparison to when we were seeing hardly any during the pandemic. So they say there are millions more appointments being carried out. Well, of course there are. But she had to, Andrea Leadsom had to admit last week in Parliament that that figure of 2.5 million is unreliable. And they're also talking about an investment of £200 million.
Yeah.
And that is coming out of the existing budget.
What would persuade dentists to take on more NHS patients? Because they have bumped up the price, haven't they? The government has bumped up the payment to dentists to take on NHS patients. So why aren't they doing it?
Well, because they're offering £50 extra for people who come in who haven't been seen in 2 years that might need some fillings.
Yeah.
But that might take hours and hours and hours of time in the surgery.
So if the local dentist to Matthew was spoken to and told, we're going to pay, the government said, we're going to pay you to see Matthew. Yeah. You're saying that would only be £50 and Matthew's case might take far longer than the £50 would cover. Yeah. Yeah, £50 might not even cover the cross-infection control or the materials that you might be needed to actually treat it.
Well, let's come back to Layla before we leave this. Layla, where are you now in terms of what happens next? I mean, how much longer, putting it bluntly, before you have to pull another tooth out?
It's going to be soon. I've got a back tooth this side. It's the one at the back, and it's really loose again. It's loose and it's sore. So I'm just waiting for it to get to a level now where I'm going to be able to pull it.
And is there, I mean, the picture I have in my head of your graphic description of how you did this is of you all on your own. Are you on your own when this happens? Because, you know, as you say, you might faint. Is there anybody there who can at least metaphorically catch you?
No, I don't. It's not the sort of thing you do when people are around.
No.
I'm just terrified if I don't find a dentist, because all my gums are now receding. By the time I finally do get one, am I going to have gums left to fit dentures to, or am I just going to be left toothless forever? I don't leave the house anymore because of that. It's
completely taken over your life, isn't it?
It's awful. It's awful.
Completely controlling your life.
Yeah, 100%. Yeah. Apart from a little bit of voluntary work at the local pantry, I do nothing. I don't leave the house.
Jeez.
Layla, I'm so sorry to hear that. Eddie, I mean, as Layla's speaking, Eddie, I can hear you tutting because of the situation that they're in, but I'm not sure. You know, you've said to Matthew, contact your MP. Matthew's contacted his MP. Layla can no longer leave the house apart from to go and do voluntary work. Yeah. You've said the government needs to talk to you. I'm not sure we've got an answer for these patients. I feel like we need to, you know, someone needs to step in.
Absolutely. You know, sadly, we've got parts of the country where we've got charity vans going around serving the local population. I mean, this is a problem that's been created in Westminster, so it needs solving in Westminster. And, you know, so many of my colleagues out there want to really help these people who are in trouble.
Matt said he had to go to a dental school. Yeah. To have. Can you explain what that involves?
Yeah, well, obviously there are training schools around the country that train undergraduate dentists to qualify as dentists, and they see a proportion of the population to actually carry out some treatments, and he may have had some urgent and emergency
So would that
treatment.
have been carried out by, it was root canal, would that have been carried out by an unqualified dentist?
It might have been carried out by someone fairly advanced in their training, but it might have been carried out by a member of staff.
I don't know what it's like to be an NHS dentist, but I know that there are dentists taking on more private patients. Yeah. Can I ask, while that might be more lucrative, it is probably not what dentists went into dentistry for. Can they not say, we're not going to take on any more private patients because there's people like Layla and Matthew out there who need our help? Yeah. And why aren't dentists saying that?
Well, because if they did that extensively and saw the volume of patients that need that sort of treatment, what would happen is that their business would fold. They need to make money to invest in the business, and actually delivering NHS treatment doesn't allow that.
OK. Well, thank you very much for joining us this morning.
Thank you.
Matthew and Lena, I don't know what to say other than good luck.
Thank you.
You know, we've done our best by drawing attention to it, and you know, as you've been speaking, huge number of people getting in touch with their own experiences.
Tales of woe.
And we heard from the Health Minister last week. But you know, good luck, good luck, good luck.
We'll stay on it anyway. We'll stay on it.
We will.
Thank you. Thank you both for sharing your stories with us this morning.